Good afternoon, everyone. Thanks for joining us once again for an update on COVID-19 vaccination in Texas. I'm Chris Van Dusen with the Texas Department of State Health Services, joined once again today by Imelda Garcia, DSHS Associate Commissioner for Laboratory and Infectious Disease Services and the chair of the Texas Expert Vaccine Allocation Panel. Also joined today by Nancy Ajuma, DSHS Deputy Associate Commissioner for Regional and Local Health Operations, and she will fill us in on the new Texas Public Health Vaccine Scheduler. As a reminder, to ask a question on vaccination, please type it into the question box. You should be able to see that on the right side of your screen in one of the drop-down boxes there. And as you type your question, please include your outlet so we can recognize you appropriately. We'll get your name automatically, but it doesn't fill in your workplace or your media outlet. And we will certainly, as always, get through as many of those questions as we can. Also, as a reminder, the briefing is being recorded. We will send a link once it is posted and available. It usually takes about an hour or so after we conclude. Without any more ado, let's go ahead and get started. I'll turn it over to Commissioner Garcia for some opening remarks.
Thank you, Chris. Good afternoon, everyone, and thank you for joining us on what is truly a big day for us here in Texas. And it's one that we in public health have been waiting for, and so have so many people all across the state. Everyone aged 16 and older is now eligible to be vaccinated for COVID-19. And quite a few things have come together to make this the right time to open up vaccine eligibility. First of all, more vaccines. Texas is getting more than 1 million first doses this week, and our federal partners tell us that the amount of vaccine will further increase in April. We've started to hear from providers in some parts of the state that we're getting to the end of their waiting list, and we're getting to the point where they had reached most of their priority groups. And as such, the Expert Vaccine Allocation Panel wanted to make sure that those providers have the flexibility to continue vaccinating people in their communities, while providers elsewhere continue to focus on people in their priority groups. We do encourage providers to continue to seek out and prioritize older adults and people with underlying medical conditions because they continue to be the most at risk for severe disease and death from COVID-19. We've directed providers to take special care to vaccinate our super seniors, those 80 and older, by moving them to the top of the waiting list and moving them to the front of the line if they show up to be vaccinated. And this is regardless of whether or not they have an appointment. And I really want to emphasize how important vaccination remains. We've seen remarkable progress in reducing the number of new cases, hospitalizations, and deaths from COVID-19 over the past 2 to 3 months, but we're still in a race against the virus, and particularly the variant strains that are circulating in Texas that we know spread more quickly and could cause more severe disease. We need to keep people vaccinating very, very quickly and are encouraging everyone to get a shot so that the variants don't get out of hand. The science points to the available vaccines being effective against the variants. So the more people vaccinated means the less chance the variants have to spread in Texas and the less chance new variants will emerge here. I've mentioned that we're getting more than 1 million first doses this week. That includes those from the federal government being directly allocated to pharmacies and federally qualified health centers. And when you add second doses, we're expecting about 1.75 million doses altogether. As far as where we are in vaccination, we've surpassed some really big milestones in the past few days. 10 million doses administered as of Friday, and more than 7 million people vaccinated over the weekend. We're now at 10.6 million doses administered, 7.1 million vaccinated with at least 1 dose, and 3.75 million fully vaccinated. And when you look at the overall population, we're getting close to 1/3 of all people 16 years and up who've gotten a shot, and just over 1 in 6 are fully vaccinated now. For our seniors, now 2/3 have gotten at least 1 dose, and about 43% are fully vaccinated. In other good news that we're excited about today is the launch of our Texas Public Health Vaccine Scheduler. This is a tool that will let people sign up to be vaccinated at vaccine clinics hosted by DSHS or a number of participating local health departments. Now, it won't be all health departments. Those that have their own scheduling tools may continue to use them, but it will bring centralized signups for public health providers in some rural and smaller and medium-sized towns and cities. For more details, I'm going to turn it over to Nancy Ajuma, our DSHS Deputy Associate Commissioner for Regional and Local Health Services.
Thank you, Imelda. As was mentioned, my name is Nancy Ijuma, and I serve as the Deputy Associate Commissioner in the Division for Regional and Local Health Operations. This very short presentation is intended to provide an overview of the systems that have been put in place to help public health entities manage the COVID-19 vaccination events that will continue to be held across the state. The release of these systems come at an opportune time, given the expansion of eligibility and the increased volume of vaccines coming to the state. Next slide. Within DSHS, we have worked to implement a two-sided system for COVID-19 vaccine event management. The two sides of the system are called the Texas Public Health Vaccine Scheduler and the Client Encounter System. Next slide. The Texas Public Health Vaccine Scheduler is the public-facing side of the system. So the Vaccine Scheduler allows Texans to sign up and schedule an appointment to receive the COVID-19 vaccine from DSHS public health regions and the about 12 local health entities who are participating in the system. There are a number of goals with the vaccine scheduler. The primary goal is to ensure that we have a place to identify Texans who are ready and willing to receive the COVID-19 vaccine. This will allow the DSHS public health regions and the local jurisdictions who are participating in the system to identify clusters of communities who are essentially ready to go in terms of receiving the COVID-19 vaccine. This will allow us to plan for the deployment of vaccines to those jurisdictions and identify communities where we can essentially host vaccination events, create appointments, and match those appointments with individuals who are ready to receive the vaccine. In addition to that, this system will allow us to identify those who are eligible for vaccination and ensure that once an appointment is created in the system, it's essentially matched with those individuals within a day if an appointment is available. If an appointment is not yet available, the system will continuously spool and it will continue to batch individuals who are ready to receive an appointment with appointments as they're being created. So even if there is not an appointment in the system on day one, as an appointment is created, even if it's a week later or 2 weeks later, those individuals who are in the system will still have the ability to be matched with those newly available appointments without having to log back in and resubmitting a request. For those individuals who are not yet eligible, and at this point, it would really just be those individuals who are under the age of 16, the system will allow us to still allow those individuals to create and register for the system, create a profile, be in the system, and once we do have vaccines available for the younger age groups, whether age 12, 13, et cetera, then we would re-invite those individuals to the system and essentially give them an opportunity to be matched with an appointment with those newly available vaccines. Next slide. So when a Texan goes into the Texas Public Health Vaccine Scheduler, there are a number of things that they can do. They can access the scheduler on a desktop or a laptop or on a mobile device, and they would create a profile, submit their information, indicate their preferences for vaccination appointments. So they can say that they are interested in receiving the vaccine on weekdays, so Monday through Friday, or on the weekend, on Saturday, Sunday. They can also indicate whether they prefer a morning appointment or an afternoon appointment. And when the system goes through its process of batching, it would identify the first available appointment that meets that individual's preferences. The system will match individuals within the county that they are residing in. So when they actually indicate within their profile their physical address, the system will essentially continue looking for appointments that meet their preferences within their county. In addition to that, it collects specific details about the individual, so it allows them to submit a vaccine client profile. The vaccine client profile asks questions such as, is this your first COVID-19 vaccine or a second COVID-19 vaccine? If an individual indicates that it's their second vaccine that they're coming to the system to schedule, then it asks them what vaccine they received the first time, and then it matches that same type of vaccine for their second appointment. So if they received the Moderna vaccine, it asks them the date that they received the vaccine, or Pfizer, and then it matches them with an appointment after the minimum interval for that second dose has actually been reached. Next slide. So as mentioned, really any Texan can sign up for the Texas Public Vaccine Scheduler, Texas Public Health Vaccine Scheduler. So if they are 16 or older, then they are considered an eligible older teen or adult. And at that point, they have the ability to be matched with an available appointment. So those who are 18 and older would be matched with any vaccine type. Those who are 16 or 17 would only be matched with the Pfizer vaccine. Those who are not yet eligible, those children, again, would have the ability to be in the system. And when we get to the point where there are vaccines available for that younger age group, then they would be re-invited to the system. And at that point, they'd be able to be matched with an appointment. Next slide. The client encounter system is the provider-facing side of the system, and it's effectively used to create and manage COVID-19 vaccination events. So as was mentioned earlier, the goal is for us to have as many people registering in the system so we can identify exactly where they're physically located across the state and work to create events in those communities. There are 3 types of events that can be created within the system. The first is the closed pod portal, so it's essentially a walk-in event. So participating jurisdictions have the ability to create events for specific facilities, for example. So if we're working with a large employer or any sort of facility that has a specific population, we can create a walk-in event where we essentially have an event-based registration link that can be sent to the individuals who are tied to a specific facility and allow them to submit all of your documentation and complete their profile and then be given an appointment for that specific event. There is the opportunity to create an event that is primarily going to be scheduled by the Vaccine Support Center. So in addition to releasing the Texas Public Health Vaccine Scheduler, we've also stood up a Vaccine Support Center, which is open 7 days a week, so Monday through Sunday, 7 a.m. to 7 p.m. And that support center is dedicated to ensuring that those who have limited access to the internet, they might have limited mobility, the older population, so Texans who are 65 and over, have an opportunity to also schedule an appointment with the support of the Vaccine Support Center. So these are individuals who might have a more difficult time identifying an appointment and scheduling an appointment online independently. They can call the support center, and we would have the allocation of appointments that would primarily be scheduled by the support center. And the goal is to, of course, try to ensure a more equitable access opportunity for individuals who might otherwise not be able to schedule an appointment. So we do have the ability to identify a number of doses for scheduling through the support center, and that can be identified at the point of creating the vaccination event. And then the last type of event is this public community portal event. So if we know that we want to create a 1,000, 5,000, or 10,000 person event, and our goal is to release as much vaccine as possible for that public match process within the scheduling system, we have the ability to do that. So we would identify the number of doses and the types of vaccines that would be made available during the vaccination events that are being created in the system. And then through that nightly batch process, those individuals within that jurisdiction who are waiting for an appointment would be matched with that next available appointment, and they would receive notifications with a QR code that they would then use to come to the event location, be checked in, and go through the process of receiving their vaccine. Next slide. So as was mentioned, the Texas Public Health Vaccine Scheduler and the Client Encounter System are two sides of this COVID-19 vaccine event management system. So that public-facing side allows Texans to create profiles and submit the information that determines really their preferences for an appointment and matches for vaccination events. It does allow us to notify individuals who are not yet eligible when eligibility changes, and it gives us some really robust information that allows us to plan across public health for the most appropriate place to actually host vaccination events and connect as many people as possible to the COVID-19 vaccines that we have available in public health. And then on the client encounter system side, it allows participating providers, the public health providers, to create vaccination events, manage the event electronically, make doses available for walk-in, so closed facility events, make doses available through appointments that are scheduled by the Vaccine Support Center, and it allows us to also make as many doses as possible available for matching to individuals who are in the system who are looking for an appointment. And all of the data within the system feeds to the state system of record for vaccinations, which is Track 2. Next slide. And lastly, we do have, as I mentioned, the Vaccine Support Center, and that is that support center that has been stood up to ensure that there is support for both the Texans who are looking to schedule an appointment, but also the providers who are utilizing the client encounter system. And this Vaccine Support Center is available to answer questions that people might have about the vaccine. If there are individuals who are not immediately matched with an appointment, they do have the ability to call the support center to identify other locations in their area, especially if they don't have access to the internet, other locations in the area that might be available for them to receive the vaccine. And it will allow them to receive notifications about their appointments via email and text messages, but then they can also call the Vaccine Support Center if they want to change their appointment or they have other preferences that could not really be self-managed within the system. And
okay. Nancy, thank you so much. That'll conclude the presentation part. We do still have some time for questions, but Nancy, thanks for doing that. I think it was important to go a little bit more in depth on the new scheduler and how that's going to work with people and how we'll be sharing that information with them. But let's get to a few questions here while we have some time. The first one's from Karen Harper at the Texas Tribune. Is there any reason, and Melda, this is, I think, for you really, is there any reason to believe that opening eligibility will make it more difficult for those in priority groups who are still waiting for access?
So we have made our expectations of our providers very clear that while we are opening up eligibility to the younger populations, we still want them to prioritize those that are both in the older, our senior populations, as well as those with chronic conditions that make them at greater risk. And so we will continue to monitor that and encourage our providers to go ahead and prioritize those groups in front of others.
William Joy, WFAA in Dallas, asks, what outreach is the state doing to get vaccines to areas with barriers that include technology, transportation, and language? And this is actually something probably you both can touch on. Imelda, maybe you want to start with how we're actually getting, allocating vaccine with that in mind.
Yeah, so we definitely are doing concerted efforts in order to vaccinate people that have a variety of different barriers to getting vaccinated. So we're partnering with providers that are doing specifically targeted outreach to those that may not have technology, some that may live in rural areas that may not have access to transportation, in order to help take vaccine to them. They are also having different ways of enrolling for the vaccine events, and so a lot of them are doing phone calls only and soliciting the population to be vaccinated that way. So we are doing targeted efforts in order to make access as easy as possible, and particularly as we have more and more vaccine coming, those types of providers will be receiving more and more vaccine as well.
And Nancy, you've kind of touched on this, but the information gathered as people register will help sort of inform, where vaccines go, where not necessarily where the vaccine is sent to, but where mobile teams and other sorts of efforts are focused, right?
Yes, absolutely. And we're going to be using that data to find pockets of opportunity across the state. And in addition to that, we are working with the Vaccine Support Center to ensure that individuals who might have language as a barrier can actually contact that center, and we'll be using tools such as our language line to ensure that we can communicate with individuals who might not otherwise have an opportunity to connect with someone who can help them through the registration process.
Moving on to the next question, Allie Morris at the Dallas Morning News notes that Texas still trails most states in vaccines administered, according to the CDC. Why is that?
So we continue to work with all of our providers across the state to administer as fast as they possibly can. We do know that some of our providers are having difficulty reporting some doses administered to us, and we continue to work with them in order to help facilitate getting that data into our registry. Now, for some, it is a data quality issue, in which case we need to work to resolve some of those. Some have acknowledged that they are simply behind on data entry and are working hard in order to get caught up in that. But we do work with each and every one of them in order to help make sure that we are getting every dose that's administered into our registry.
A question from Rudy Morelos down at KRGV in the Valley. Will more vaccines be sent to areas where higher priority groups are still waiting? How do we address that in allocation?
So the way that we do our allocations, we are still very much trying to have an equitable distribution across the state. Now, one of the things that you should have noticed in week 16 distribution is having broader access points through a lot more pharmacy locations and grocery store locations as well. Now, for those targeted areas where we know that they may have more vulnerable or more difficulty, or populations that may have more difficulty getting access to those, we are still doing targeted allocations to those providers that are having unique ways to be able to reach those populations.
A question from John Moritz with the USA Today Network. He says the president just set a goal for having a vaccine provider within 5 miles of most people. Is Texas on track to meet that? And then he also asks, or notes, the governor said last week that demand seems to be declining. Are people seeing a flattening or declining caseloads and saying maybe I don't need a vaccine?
So first, let's take the distance question. Within 5 miles of where people may be, obviously Texas is a very big state, and we have a lot of counties that are very much a frontier component. But we are working hard in order to make sure that we have additional access points where providers are currently located, as well as encouraging enrollment of other providers. But the other piece, and this goes along with what Nancy was saying, where we know we have pockets where there may not be a provider, particularly in our frontier areas, our DSHS regions, as well as our partnership with the Texas Division of Emergency Management to send military teams out to some of those really frontier areas, play a critical role in helping ensure those in rural and frontier areas have access to our COVID-19 vaccines. Now, as far as the other question about how quickly we continue to roll these things out, I think we are on track to continue pushing in that direction. We continue to monitor the situation with our COVID-19 cases, our hospitalizations, our positivity rates. It's something that we're monitoring very, very closely. Now, we do want to really reiterate that prevention is still key. Even if you haven't gotten your vaccine yet, wearing a mask and socially distanced is still really important to help us keep the spread down. But we will monitor the situation and see how things go.
From Aparna Zalani at KTVT, just to clarify, can super seniors show up to any location without an appointment and get to the front of the line?
Yes, that is the direction.
Another question from Allie Morris at the Dallas Morning News. What's the latest with variant spread in Texas? How many variants have been identified, and how are they spreading, and is that spread accelerating?
So we continue to monitor the variants all across the state through our network of labs that are doing that additional testing. Now, what we do know is that over 500 variants have been identified across the state. there are pockets, however, it has been found fairly widespread across the state, and we continue to work with our local health department partners that are on the ground to continue and enhance surveillance for these variants, and we'll provide additional information as new data comes through.
And just to clarify, 500 variant cases, not 500 different variants.
Yes.
So, and I know we should have, I would say tomorrow, we're expecting to have an update on the number of variant cases that have been identified so far in Texas. The vast majority to this point have been the UK variants. That I don't know the percentage, but it's over 90% of the variant cases we've seen in the state so far. Checking another question here, Paul Weber with the AP says, Commissioner Garcia mentioned how some areas are getting to the end of their waiting lists. Are there some communities in Texas struggling to find takers for their allocated doses right now?
Yes, we have heard from some of our providers that demand has definitely decreased over the past couple of weeks, that some have had trouble filling their appointment slots. So we are working with those providers that may have excess inventory to develop plans in order to fully use it. In some cases where they may not be able to use it on hand, we are working to transfer those doses to other providers that can effectively use the vaccine if they don't have the demand there at the specific provider clinics.
Question for Betty Cross at CVS Austin. Bigger vaccine shipments are expected in April. I understand you don't have exact numbers, but how many more doses do you think are likely to come each week? What's realistic to expect?
I wish I could tell you a number on that. One of the, there's two big things that are happening. So we do expect that AstraZeneca will file for emergency use authorization in early April, likely, in the coming days. And then we also expect Novavax to be able to also file for emergency use authorization. As far as the volume of what those new vaccines will bring and when that comes, we're still unclear right now.
Aparna Zalani also asks if we can provide a list of the providers and participants involved in the vaccine scheduler, and we will. We'll have a news release out shortly after this, and so look for that. You'll see a list of, so in addition to the DSHS public health regions that cover parts of the state without a local health department, you'll see a list there of the local entities that will be using the scheduler, and of course that could increase over time. Those will be coming in over the next couple of weeks. To begin, kind of pulling their clinics into the system, and then it certainly could expand out from there, and we'll certainly keep you updated on that. A question from Kayla Harris at the Houston Chronicle, and Nancy, this is for you. Approximately how many appointments will be available weekly through the state's new sign-up page, and about when do you expect the state to host its first event based on sign-ups through that website registration?
Well, the goal is to create events with as many vaccine doses as we have available. We've actually already been using the system for about a month now. We went live with a version of the system on March 1st. And that version of the system was really intended to ensure that we had some time to pilot the application and really use it with live events. So far, we've been hosting events up to about 3,000 doses per event. We actually had a very large event over this past weekend with one of the local health entities who's integrated into the system. So ideally, we would get to the point where for all of the individuals who are registering and indicating readiness to be vaccinated, where we're creating events pretty much as quickly as those individuals are registering up to the number of doses we have available. So within the public health regions, our goal really is to ensure that we are utilizing as much vaccine as we're receiving and as quickly as possible after receiving it. So it's going to slightly be dependent on the volume of vaccine that we have allocated and distributed to the regions, but also it's going to really be dependent on areas where there are sort of pockets of interest that develop. And our goal is going to be to create within a week, let's say, an event in areas where there's huge saturation and where individuals are ready to go.
I have time for just a few more questions. I have to apologize. We've lost Commissioner Garcia's webcam for some reason. So if it comes back, you'll be able to see her again, but you can still hear her. And Nicole Cobbler has a question from the Austin American Statesman. This is one we've heard before, and I think one that people are still really curious about. What percentage of Texans need to be vaccinated before reaching herd immunity? And what percentage of Texans does DSHS believe already have immunity from COVID, either through having the virus or through vaccination?
So what we know right now is that every day we're getting more and more people vaccinated, and we know that our cases are going down. The science is still unknown for how long the natural immunity from contracting COVID-19 really lasts. Research is still ongoing on that, and then we'll know about that soon. But depending on what literature you look at, herd immunity can range from anywhere from 70 to 90% being needed in order to really have that protection level. So we don't know yet what Texas really needs in order to be able to have a protected population against COVID-19.
Another last couple of questions here. One from Vanya Patino at News Channel 10 in Amarillo. Now that eligibility is open, are hubs still required to give out a certain number of vaccines every day, or has that changed? And are there plans, and I'll answer this one first actually, are there plans in place like a phone number in case the schedule or website crashes? So there is a phone number, and I can give that to you now. It'll be in the news release as well. But that number is 1-833-832-7067. And as Ms. Ajuma mentioned, it's available from 7 a.m. to 7 p.m. 7 days a week. And the goal of that, we want people who can sign up online to take advantage of that so that the phone line remains available for people who are older, 65 and older, have limited internet access, or have some other barrier that prevents them from using the online system to register. So again, that really is for targeting special populations who need a special assistance registering vaccines, and would ask that as many people who can, it will be quicker and easier for them to use the online portal to sign up. But the first question about eligibility opening up and hubs, sort of the number of doses that hubs have to administer on a daily or a weekly basis.
So the expectation of all of our hubs, and quite frankly, all of our providers, is that they burn through every dose that they're allocated within 5 to 7 days that they received it. So at any given time, they should have very limited inventory on hand. Now, we do know that some providers after the storm had built up some inventory, and as I mentioned earlier, we are working with them to transfer their doses to other providers that can use them timely. But at the end of the day, every provider, whether you're a hub or not, is expected to burn through every dose they have within 5 to 7 days.
And one final question from Nicole Cobbler at the Austin American-Statesman. DSHS was concerned about rising COVID cases after spring break. New cases and the positivity rate remain low, so is that still a concern? And has DSHS seen any increases in certain parts of the state because of spring break gatherings?
So I think there's still time yet to see how that plays out. So, typically we look to see 14 days post an event. And so we still have a little bit of time that we're looking at. But we are pleased to see that the number of cases and positivity rates have not increased substantially and have actually been on the decrease. But as I mentioned earlier, we're going to continue to monitor and see how the data shows and what trends we're going in.
Well, thank you, Commissioner Garcia. Thank you, Deputy Associate Commissioner Ajuma, as well, for being with us today. Thank all of you for joining us. We ran a little bit over time, so appreciate your patience and appreciate you sticking with us. Once again, as a reminder, we'll have a recording that will be available to you. We'll send out a link when that is posted online, and we'll let you know when our next briefing is. Have a great rest of the day and a great week.